Hi, so this is just to clarify my setup. The naloxone kit is to represent the anaphylaxis kit, hand sanitizer, a garbage bag, a sharps container, a container for supplies. The Q-tips box is to represent the insulated vaccine bag. We have the injection pad, a sterile pad, as well as a blank piece of paper to indicate a patient record.
Hi, my name is Megan. I'm a second-year nursing student here at NURS College. I'm going to ask you some questions today and then hopefully proceed with your influenza vaccine.
Okay.
Can I get your full name and date of birth, please?
Joshua Fraser, and I was born August 30th, 2002.
Okay, perfect. And then you have not received the influenza vaccine for this season, correct?
Correct.
Correct. And then do you by chance work, live, or attend school here in Alberta?
Yeah, I live here
Okay.
in Alberta.
Perfect. And then I just have some questions about your general health. How are you feeling today?
I'm feeling good. Thank you.
Perfect. And then do you have any allergies?
I do not.
No? Okay. And then you have never had a reaction to a vaccine before, correct?
That's correct.
That's correct. Okay. And then do you have any health conditions that require you to visit a doctor regularly?
No, I don't.
Okay. And then you haven't been to your doctor recently for a health condition?
No.
Okay. Perfect. And then do you take any medications by chance?
I do not.
You do not. Great. Just going to go over some general information regarding this vaccine. So you are receiving the influenza vaccine for the 2022 and 2023 influenza season. Some of the benefits include prevention in regards to contracting the influenza virus. And if you were to contract the influenza virus, it could help lessen severity of your symptoms. Yes. So this is a quadrivalent vaccine, meaning that we have 4 strains. AHS has decided that these are going to be the most common strains of the influenza virus circulating this influenza season. So you have A, Victoria, A, Darwin, B, Austria, and B, Phuket. Some side effects that you can experience today is some soreness in regards to your injection site. A little bit of redness is common as well. It is possible that you will have some cold-like symptoms, so like a slight fever. Just take what you regularly do to manage pain. I unfortunately cannot recommend anything in regards to that. For the soreness, please feel compelled to use a cold compress to help alleviate the tenderness if you feel it is needed.
Okay.
It is regulation that we do ask you and require you to stay 15 minutes after the immunization just to make sure that you don't have any adverse effects and that you are in fact feeling comfortable to proceed throughout your day.
Right.
How this vaccine will work is all set up and on the syringe for you. And I'm just going to use a little bit of the vaccine, exactly 0.5 milliliters, to inject into your adult's leg.
Okay.
Now, do you have a preference of which
Let's just do my
arm?
left.
Your left? Oh,
Yeah.
okay. Are you by chance dominant in your right?
I am, yeah.
Yeah, a lot of people prefer to use it in their non-dominant hands.
Okay.
So that's perfect. And then, by chance, do you have any questions for me?
I do not.
No, that's okay. And then I just have to formally get your consent. So do you consent with me proceeding with this vaccine?
I do.
Perfect. Okay, so I'm just going to set up everything and make sure that it's all good for you to go.
Okay.
I am opening the insulated vaccine bag and I'm taking out the correct medication vial. It says influenza or Fluzone as the brand. I am taking note of the expiry date as well as the lot number. I am checking for any discoloration or particulates, and then I am showing my client the vaccine. So we will not administer all of this. We're only doing a little bit, exactly like I said earlier, 0.5. I am going to record the lot number down, and then I will agitate the vaccine. I then swap the vaccine to ensure that it is sterile. And then I allow it to dry. I then select a 3 milliliter syringe with a Lurlock tip, as well as a 25 gauge 1-inch needle. I am opening both the syringe and the needle, ensuring not to touch the tips to make sure that it is sterile. I will then put 0.5 milliliters of air into the syringe and then take off the cap carefully. I will then put 0.5 milliliters of air into the vial and then administer 0.5 milliliters of the vaccine into the syringe. I'm going to flick any of the air bubbles out. And then also double check to ensure that this is in fact the influenza vaccine and that it is not expired. I am going to return the vaccine into the insulated vaccine bag and then perform hand hygiene. So you said your left deltoid, correct? So I'm just going to landmark that for you. Could you please put your elbow up here and relax your arm? Okay, sorry. And I apologize in advance if my hands are cold. I am going to find the tail of the deltoid and then 3 fingers from the chromium process down to the middle. I am also going to wipe down the injection site. And take notice how the injection site is on the axilla line. Okay, so I'm just gonna hand you this cotton ball for afterwards.
Okay.
You can put slight pressure on it just as it helps with the pain and any blood that were to come out. Okay, I am going to put my thumb and forefinger on the deltoid. And I'm gonna use the scoop method to take my needle out. I am injecting at a 90-degree angle, holding the needle and syringe with like a pencil. I insert it smoothly. I'm pausing to check and make sure there is no backflash. Holding the barrel with my non-dominant hand, I administer the vaccine. I will remove the needle at controlled pace and over the sharps, eclipse, and put down. I am going to then guide the client's hand with the cotton ball onto the injection site. Perform hand hygiene. And sir, could you please wait 15 minutes in the waiting room just to make sure again that you have no adverse effects to the vaccine. You are good to go, and I'm just going to record the right documentation.
Perfect, thank you.
Thank you.